it's important to really remember that when it comes to the comprehensive health of our patients, so much happens and so much comprises of their health outside of when they come to the hospital and outside of when they come to the clinic. So the food that they eat, the homes that they live in, so the impact of being a community leader and a community organizer is something that is going to carry me forward as I take care of and as I pour into my patients.
I feel incredibly optimistic by hearing her stories, by seeing what she's done and what she's been able to accomplish by rallying other medical students. And it gives me hope that in the future, we will transform the way healthcare is delivered. So we will move away from just diagnosis and treatment to understanding individuals in totality and how we can really help support individuals in every aspect of their lives. So not just in terms of what we see in a lab, but really, is that person doing well in life? And if that's not the case, then what are the things that we can impact, either ourselves or with community partners, to really elevate the existence of that member? I hope that that's what healthcare looks like, and I think that future doctors like Debbie are really going to pave the path for us. What we know now, which I think is an evolution in our thinking, is that, as Debbie said, much of healthcare is impacted by things that happen outside of the doctor's office. So those social issues are incredibly important. Having food that's nutritious, having safe and affordable housing, having childcare, having employment, those have as much of an impact, if not more of an impact, than the things that we do as clinicians to diagnose and treat disease.
I think it's very important to think about a holistic approach. We talk about whole person health, and that's what that encompasses. It is important, though, to realize that not all providers got that in their training. So let's not put it all on the providers. Let's think about all the other folks, the member themselves, the families, other healthcare providers that are not physicians or not nurses. There are family health advocates, there are doulas, there are all kinds of ways to impact the healthcare of an individual, and we need all those communities to be a part of that. That's something that we just have to do. It's part of our mission. We live, we play, we work in these communities. These are the members that we serve, so we have to be a part of the community. And investing in the community is more than just a financial or just a volunteer. It encompasses a lot of different things. We are truly collaborators with the community organizations because we all bring something different to the table by leveraging each other's resources, strengths, knowledge. That's how we're going to make a bigger impact for the members that we serve.
No one entity is ever going to be able to solve all of the issues. We need to work together in concert with each other in order to be able to address all the needs of our community. Our life services program is incredibly innovative, and it is dedicated to helping our members face all of the things that are non-medical, but certainly have impacts on their health. For our members that choose to do so, they can be paired with a life coach who helps to understand where that member is in life and what the barriers are to them achieving their goals, in particular their employment or education goals. And then the life coach helps to create a plan to bust through those barriers. And we use both internal resources as well as external community resources and community-based avenues in order to help that member bust through those barriers. We want to help them stabilize and thrive in their lives so that they themselves and their communities are as healthy as possible.
Quality is the end game. You can't just say, oh, we're doing this and we're doing that for the members if it doesn't have a quality component. It's the quality, not the quantity of what we do. So it's important that if we are going to be doing initiatives, working with members, working with the community, that we have in mind, so what does quality look like? What do we have to do to achieve that ultimate goal? And then think about, how do we measure it? How do we evaluate, is this working, or do we need to go in a different direction?
I think about being intentional. I think about as I begin my career as a physician, making sure that every time that I meet with a patient, I imagine that this might be the last time that I meet with them. So making that moment count.
So Debbie stole one of my words, which is intentional. Because what I was going to say is quality in my mind is moving intentionally towards a particular goal or outcome. And I think what is key to that is data capture and analysis. And I think that there's an opportunity for us in healthcare in general to make sure that we are capturing data and we're analyzing that data to make sure that we're moving the needle. Because we may think that we're providing a great service. We may think that a treatment has the desired outcome. We may have convinced ourselves of many different things, but when we look at the data, that tells the real story. And so I think as a managed care company, we need to be on the forefront of collecting data, segmenting that data by populations to look at what outcomes are we receiving and whether those outcomes differ by the population.